Thank you, John, for that introduction. It's a pleasure to be here today as at the Rural Health Care Policy Conference. Since becoming Parliamentary Secretary for Rural Health North just over 2 months ago, I've been busy getting up to date on a range of healthcare issues that are affecting Albertans in rural and remote areas across this province. And as a lifelong resident of northwestern Alberta, I have firsthand experience with many issues that now show up on my desk. I know that those of us who live in areas that aren't close to the big centers often face challenges being able to access health care when and where we need it. That's why I'm pleased to be part of the efforts to find solutions to get all Albertans the care they need as close to home as possible. This process starts with the Rural Healthcare Action Plan, which lays out our focused path forward towards equitable health care in all parts of this province. The plan focuses on 5 key areas, starting with attracting and retaining healthcare workforce. This includes creating a more rural training opportunities, such as the development of the Rural Medical Education Program Training Center right here in Grand Prairie. And I'm pleased to say that our first cohort of 30 medical students will start their training this fall. We are also providing bursaries for resident family medicine physicians and emergency medical responders to learn, live, and eventually practice in rural and remote communities. Another aspect of the plan is aimed at delivering timely and high-quality healthcare services by tailoring healthcare models and solutions to serve the unique needs of rural and remote communities. This, of course, includes investing in things like mobile health services that can bring crucial treatment to Albertans who are unable to travel to the larger centres, and expanding life-saving services like dialysis in places like the QE2 Ambulatory Care Centre right here in Grand Prairie to treat both those from in and out of town. The Rural Healthcare Action Plan is also supporting community-specific care to promote physical and mental well-being and prevention and wellness initiatives to encourage healthcare awareness. One of these is the Rural Health Injury Prevention Initiative that is studying the impact of injury prevention programs aimed at developing tailored, person-centered injury prevention strategies specifically for rural communities. Even given all this progress, I know we have so much more work to do, which is why meetings and discussions like today are extremely important. Hearing others' firsthand perspectives and having the opportunity to discuss issues and share knowledge that can further and even inspire our critical work. Through it all, our commitment to improve healthcare for Albertans in rural and remote areas remains steadfast. Thank you all for your dedicated work and for coming together today to ensure high-quality healthcare is accessible to all Albertans, no matter where they live in our province. Thank you very much.